Alright, Stephanie, so what's the problem we have today?
So I've been experiencing some pain in my left anterior hip.
Okay, perfect. Was there a specific mechanism that caused this pain?
Well, I do different exercises and I have a bar class that I do, and I think by using bands on my knees and doing curtsies and plies repeatedly has helped me strain that anterior hip area
Okay, and when would you say this happened?
about 3 months ago.
Okay, perfect. Have you seen a healthcare professional since?
I saw an osteo about 2 months ago.
Okay, and were there any particular diagnostics tied to you?
He realigned my pelvis area.
Okay, okay, good to know. And when it originally happened, was there anything that you had done to help deal with the pain, either icing or rest, whatever it may be?
Yeah, I did some heat and ice, and I tried to take a couple of days off, a week in between doing that class again.
Okay, good to know. Have you ever had any injuries in this area before?
Yeah, I had a chronic that now has gone away, but the same area I had a groin injury on the left side
Okay,
about 10 years ago.
okay. And any orthopedic problems at all?
No,
Okay, any surgeries?
no,
Okay, good. Any family history with chronic hip problems,
no,
knee problems?
no.
Nothing. Okay, good to know. Perfect. Okay, so in terms of the pain, did you hear a snap, crack, or pop, or any crepitus, like a feeling of like crunchiness in the area?
No, just a strain and like a throbbing pain.
Okay, so the quality you would consider to be throbbing. It wasn't sharp. It was more like a chronic.
Yeah, just a throbbing, intermittent pain. It's not always there, but if I overdo it, I definitely feel it, and it's tender and vulnerable.
Okay, and with that tenderness, do you ever experience any heat?
I'd say there's inflammation. It feels swollen.
Okay, so swelling you feel?
Yeah, not major, but compared to the other side, it does
Yeah.
feel tender and slightly swollen.
Okay, and any redness?
No,
Okay. On a scale of 1 to 10, 1 being barely any pain, 10 being you got hit by a car, where would you rank the pain?
5.5, 6.
Okay, perfect.
Especially if the other one is being hit by a car.
Yeah. Okay, and what tends to provoke the pain?
Overdoing it with those plies and curtsying and lunging on the other side, and I now eliminated the bands completely. I just don't use them in my bar class.
Okay, so anything that really exposes that growing area where you have to use the growing, or anything that stretches the area?
Yeah.
Okay, good. And in terms of alleviation, what help makes it like feel better?
Heat.
Heat, so like putting like a
Heating pad. Yeah.
Okay.
Yeah.
Okay, that's worth noting. Perfect. And do you have any radiation at all in the area, or would you say that it's pretty localized?
No, it's pretty localized, but it's in that like long, feels like that long muscle at the crease of my hip.
Yep. Okay. Good. Okay, perfect. So now I'm just going to ask you a couple background questions before we get into the assessment. So, one, just need to know your age.
52.
Okay. Any allergies?
No, just seasonal allergies.
Okay. Any medication you're taking?
I take thyroid medication, Tapazole.
Okay. Overall general health, would you consider yourself healthy?
I'm healthy, yeah.
Okay, good. Previous medical history?
Just thyroid disease.
Okay, good to know. In terms of the, they're basically called red flags. We just got to go through a screening. So, do you ever experience any unexplained weight loss?
Not related to this, no.
Okay, good. Next one, do you ever have any tingling or altered sensation in any
No.
part of your body? Any
No.
shortness of breath at rest?
No,
Any trouble going to the bathroom?
no,
Okay, perfect. And last one, any night sweats or fever that's unexplained?
no,
Okay, perfect. And in terms of yellow flags, do you have any unexplained fainting at all?
no,
Okay, abnormal signs or symptoms?
No,
Okay, and bilateral signs or symptoms?
no.
Okay, perfect. Okay, so now we're gonna get into the activities. So I'm gonna ask you a bit about like your workout program and your scheduling. So, you say you do exercise classes. What are these exercise
Okay,
classes?
so I do mat Pilates class where
Okay.
it's strengthening the core, lengthening the spine. It's mostly stretching and that kind of thing. So the mat Pilates, I do a bar class, which is I think that's pretty self-explanatory, and I do a light weight class,
Okay.
and I do eccentrics once a week.
Okay. Okay. So quite a bit of physical activity there. Years of experience with exercise training.
My whole life.
Okay. Good. So frequency
About 3-4 times a week. Yeah.
Okay. Okay. Perfect. And when would you say is like the next time you're gonna be working out?
Well, so in between, I take a day of rest off, twice a week,
Yeah,
and then
sure.
I'll go for a hike on the weekend or a long walk with the dog
Okay.
to walk it out and
Sure.
stretch out.
And have you had any changes in your program at all?
I would say since COVID, I've added an extra day, the weight class.
Okay, so you
Is
started
new.
resistance training.
Yeah.
Okay. Good to know. The equipment that you use in your classes, what would you
It's
say?
bands and the stretchy straps and
Sure.
light weights.
Okay. And footwear?
No, mostly barefoot.
Okay, good. And last but not least, the surface that you train on, is it?
Just a regular floor.
Okay. Okay, perfect. So if you're okay with it, we're gonna proceed with the assessment.
Sure.
So I'm gonna give you my 3 indices of suspicion after going through your history, what I think that your injury could be. So 1, I think that it could be a psoas muscle strain. 2, we could be dealing with some anterior hip impingement.
Okay.
And last would be a torsion of your sacrum. So more like a chronic thing where if there are certain imbalances, your sacrum is going to start to turn to one side.
That makes sense.
Yeah. So we're going to continue, and we'll see you soon.
Thank you.
Okay, so you've gone and checked it in the mirror. Have you seen any deformities, any bruising, swelling, redness?
Just swelling, very slight swelling on the left side.
Okay, Stephanie, so go ahead and walk out for me. Okay, so we got a good arm swing. If we're looking at the feet, we have some pronation and some external rotation, especially on the right foot. We have significant weight transfer in the hips with each stride. We have a good heel to toe strike, good arm swing, somewhat stiff thoracic back. And if we look at the pelvis, it stays pretty level. We don't see any Trendelenburg signs. However, the right hip does drop a bit. Okay, so we're gonna go ahead with some functional movements here. So first I'm gonna have you give me 5 good squats. Okay, so we have that hinge at the knees are coming forward a bit. Good. Okay, perfect. Now can you give me a curtsy lunge? Okay, any pain there?
I feel it. I feel it in the front.
Okay, and same goes with your plie.
Plie. Usually hold on to the bar.
Yeah. Any pain there?
Yeah, a little bit.
Okay, very good. Okay, and when you walk, any pain at all?
No, it actually feels good. It lengthens it out. It stretches it out.
Okay. All right, so before we get started, we're just gonna go ahead and clear your lumbar spine. Okay, so what that means is we're gonna go through a few motions. Once we clear that, then we'll get to the actual head. So I'm gonna have you come here. You're gonna come down, reach all the way down, touch your toes. Good, and I'm just gonna apply some overpressure, so no pain there. Okay, sit up. Then you're gonna put your hands on your back. You're gonna reach back, and if it's okay with your permission, I'm just gonna push here. Is that okay?
Yeah.
No pain there?
No.
Okay, now we're gonna go down the side. You're gonna reach your hand all the way down the side, stabilize here. Over pressure, just feel a tissue stretch. Same thing on this side. Stabilize here, tissue stretch. Good. Okay, now you're gonna come here. You're gonna put your thighs against the couch here. You're gonna put your hands here. You're gonna rotate to one side and do the same thing on the other side. Very good. And then come apply over pressure, tissue stretch. Other side. Over pressure, tissue stretch. Okay, very good. So now we're gonna go ahead and do the resisted ranges of motion. Unfortunately, we don't have a massage table or a therapy table, so we're gonna be using this handy dandy bench. So you're gonna come sit down on the edge here. Come with your feet facing this way. I'm gonna grab a pillow. So we're gonna start off with some flexion extension. So I'm gonna come here, put my hands up here. You're gonna go ahead and give me like an ab crunch to start. Good, no pain there.
No.
Same thing backwards now. Good, no pain.
No.
Okay, crunch into me. No pain there. Crunch away from me. No pain.
No.
Okay, twist towards me. Towards me. Like twist. Good. And same thing, twist away. Good, no pain there.
No.
Very good. Okay, so now I'm gonna have you lie on your back. We're gonna go ahead and clear the joint above and below. So we'll just lie down. So I'm gonna come here, go with some pelvic distraction and then compression. So we're gonna start off with compression. So I come here, put my hands on your SISs, and push down. Any pain there?
No.
Okay, and now pain when I squeeze in?
No.
No pain there. Okay, very good. I'm gonna have you just, actually you're fine just there. So you're gonna go ahead and you're gonna curl your ankle towards your butt. So go ahead, pull it towards you. Any pain there?
No.
Okay, and the same thing on this side, curl. No pain there?
Just weaker.
Just weaker, okay, that's fine. Now you're gonna go ahead and extend. So go ahead, push. Any pain there?
No.
Okay, 1 second. And push.
Just weaker.
Okay, that's fine. So I want you to just give me full knee extension. Any pain there?
No.
And if I go like this?
No.
And same thing on this side. Any pain here?
No.
Okay, good. Now you're gonna bring your knee up, like flex your hip and just bend your knee without grabbing your hand.
Oh yeah?
So just flex. Any pain here?
No.
Okay. And when I do this?
No.
Good. Okay, so now we've cleared the joints above and below the hip. Now we're gonna assess the actual hip, okay? So the side with pain is your left side, correct?
Yes.
Okay, so we're gonna start off with the right side. And what we're gonna start with first is some hip flexion, okay? So you're gonna go ahead like you did before without using your hand, just bring your hip to your chest. Good, as high as you can. Good, I'm gonna come here, apply some over pressure. Any pain there?
No.
Okay, good.
I just feel a stretch here.
Yeah, that's normal. So no pain when I did this?
No.
Okay, good. Then we're gonna go ahead and you're gonna actually do some resisted hip flexion right now. So same thing, just gonna pull towards you. Any pain there?
No.
Okay, that's fine. Now we're gonna go ahead and do some abduction, adduction. So if you could just slide up a bit, if you don't mind.
Up?
Yeah. Well, actually your head's gonna hang. Okay, that's fine. So you're gonna go and you're gonna push your leg. Well, bring your leg out as far as you can. Just bring it, abduct it, and try to keep your toes pointing straight up to the ceiling. Okay, keep this leg straight here and go as far as you can. Okay, any pain?
No.
Just a stretch. Good. And same thing here. I'm just gonna lift this leg and go across this way as far as you can. Any pain there?
No.
Over pressure. Okay. Very good. So now that we've done those two, we can do those two resisted. So you're gonna go ahead and push out. So push out into my hand. Any pain there?
No.
Okay, and pull in. Good. Any pain there?
No.
Okay, good. Bend your knee. Now we're gonna do some internal external rotation. So I want you to keep your leg up here. Now you're gonna push push your ankle towards me. Basically, just no. So you're not gonna resist. You're just gonna turn your leg like that as much as you can. Okay. Any pain here?
No.
Good. Same thing other way. Any pain there? Okay. Good. Now we're gonna go ahead and do resisted. So you're gonna push it into my hand. Go ahead. Any pain there?
No.
Okay. And now push it to me. Any pain there?
No.
Very good. Okay, now I'm gonna flip you around because we're gonna do hip extension. So we're gonna get all the hip extension done in one shot so you don't have to flip over twice. So just lie down. Perfect, okay. So we're staying on the right side here. So you're gonna go ahead. I'm gonna stabilize here. I just want you to lift your right leg right now. So keep the leg straight, just lift it up as high as you can. Good. Hold it there. Any pain?
No.
No? Very good. Okay, so we've done the active range of motion. Now I'm going to go ahead and do it passively. So lift up just a bit and relax. If I lift it, any pain there? Good. Okay, now you're going to resist. Okay, so you're going to push into my hand. Lift your leg up. Any pain there?
No.
Okay, very good. Now we're going to go ahead and do this side since we've done all the other ones on the other side. So here we go. You're going to just go ahead and lift up this leg. Any pain there?
No.
Now when I bring some overpressure?
No.
No? Okay, very good. Now you're going to go ahead and I'm going to do it passively. 1 second, so relax. I'm just going to lift. Any pain there?
No.
Okay. And now resisted, you're going to push up into my hand. Any pain there?
No.
Okay, good. Okay, sorry, we're just going to turn around one more time. Okay, and lie down. So now we're going to do the ranges of motion on the injured side. Okay. So you're going to bring your hip into flexion. So what you did before. So you're going to bring it both out your hands. So you're just going to hold it there at the highest you can go.
Yeah.
Okay. I'm going to leave a little overpressure. Sorry, we just did the right leg. My bad. We're doing the left. Okay, so bring it up. Good. And if I bring some overpressure, any pain there?
Just tender, sore.
Okay, so relax now. I'm just going to do it passively. If I do it for you.
I feel it tender.
Okay, and now if you just hold this here and you resist into me.
It just feels a little weak.
Okay, that's good. No, okay, so now we're going to go ahead and we're going to do abduction, adduction. So you're going to take this leg and you're going to keep your toes pointing to the ceiling and bring your leg out as far as you can. Okay, but you don't want to lift up, so we're going to keep it there. Okay, good. Apply some overpressure. Any pain there?
No.
Okay, and now we're going to do the same thing, bring it underneath. Any pain there?
No.
Just a stretch?
Yeah.
Okay, now we're going to go ahead. You're going to push your hand out into your foot into my hand. Good. No pain there. And now pull it into this side. Pull it towards. Good. No pain there.
No, just weak.
Okay. So now I'm going to come do this passively. So if I come here, no pain there. And if I bring this up, bend your knee, and bring this across, any pain there?
No, just weak.
Okay. So relax. So now we're going to go ahead and do the internal external rotation. Okay. So we're going to be careful here. So you're going to hold this up. You're going to twist your ankle out first. We're going to go internal rotations like that. Any pain there?
No.
If I go like this.
Just uncomfortable.
Okay, and same thing other way.
No problem.
Can you hold it up for me without me
Yeah.
holding? Okay, good, relax. And if I give it a little bit of, if I do it myself, sorry.
No problem.
Okay, and if I do this one myself.
Not as comfortable.
Okay, so now you're going to go ahead and you're going to resist. You're going to pull towards you, good. Any pain there?
No.
Okay, and then we're going to go ahead and do this side. Hold this, push out. No pain there. Okay, very good. Alright, so the first special test we're going to do is called Craig's test. So basically what Craig's test is going to help us look at is the angle of your hip and the angle that your the head of your femur goes into the acetabulum. So what we're going to do here is we're going to bend this leg. Okay, I'm going to come palpate the greater trochanter here. And I'm gonna turn your leg into internal rotation. I can feel as I go into internal rotation, the greater trochanter moves posteriorly. So I'm gonna wait and basically move it through the range until I feel the greater trochanter coming to parallel with the floor. So for you, that feeling is right about here. So if we leave it right here and we take a look, that's about 10 degrees. And then if we come on this side, same thing. Palpate the greater trochanter. And then we want to get the parallel. Right about there. And about 10 degrees too. Okay, so angle of the hips is good. Now we're gonna go ahead and I'm just gonna have you flip around onto your back. We're gonna go for the scouring test. So this can help us see if there's any impingement in that anterior hip.
Okay.
So just go ahead, lie down on your back. We're gonna start with the unaffected side. So I'm gonna go ahead, grab your leg, bend your knee. We're gonna go into adduction and we're gonna go into like a big circle out. So adduction, flexion, and we're gonna come all the way out. Any pain there?
No, it's just deep.
Okay. And if I do it again?
No.
No pain, okay. Now we're gonna do it on this side. So I'm gonna grab. Okay, so here, I'm gonna go adduction.
It's like sticky there.
Okay, what do you mean?
Like it, and it's not comfortable when you, okay, go. Like there, that hurts.
Okay. Does it feel like tight and jammed in that area?
Yeah.
Okay, so positive scouring test, duly noted. Okay, so now I'm gonna have you sit up and we're gonna spin you around so that your legs are just hanging off there. There we go. So for this one, we have the thighs at parallel with the floor. We're gonna go ahead and test two different hip flexors here, okay? So first one, we're gonna go for the hip flexors as a group. So we're gonna start off with the unaffected side. So I'm gonna come here. And from here, I'm gonna have my hand on the opposite, on the same ASIS. And I'm gonna have you just lift your leg up and push into my hand. Hold it there, any pain there?
No, just weak.
Okay, so that's fine. That's about a 4 on 5, 4 plus on 5, sorry. I'm gonna go ahead here and bring it up and resist.
Just weaker.
Yeah, so this guy is weaker. So that to me looked like about a 4 minus on 5. Okay, so now, and in terms of the 4s and 4 minuses, basically it's a grading scale on 5. The lower it goes, the less higher score is on 5 for the strength of the muscle. Okay, so now what we're going to do is we're going to go ahead and test the iliopsoas. So what we're going to do for this one is instead of just lifting at 9 now, we're going to start higher, okay? So I'm going to have you keep an upright posture and you're going to go as high as you can and lift your knee, and at that highest point we're going to resist, okay?
Give us leg first.
Yeah, let's leg first. So stay tall. You're going to bring the leg up, all the way up, good. And you're going to resist. Hold that there. Okay, good. That's not too bad. And now let's go on this side. So bring that knee up. Good, try to stay tall. Resist. Okay.
Definitely feels weaker.
Yeah, that's definitely.
And it's tender when I push there.
Yeah, you feel pain?
Yeah.
Okay, good to know. Okay, so now we're going to go ahead and do the glute max muscle test. I'm going to have you just lay down on your stomach. Okay. So I'm going to start off on the unaffected side. So we're going to have you here bend your knee. You're just going to go ahead and lift this thigh off the floor, off the table. Lift, 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 and resist. Any pain there?
Oh, I feel it in here.
Okay. Okay. And now let's do the other side. Come and bend this knee. Keep this guy down, and you're gonna come and lift this off the ground. Okay, that's better. So on this side we had some weakness and some compensation on the other side. So that's definitely. Okay, so we're gonna go ahead with our modified Thomas test. So you're gonna go ahead, grab that knee, perfect, bring it to your chest, all the way up, and let that leg drop and relax. Okay, so we see clearly a lot of tension on the lateral side here. If we look at the ankle of the knee, the foot does not touch, and we have about a 110 degree angle. Not too bad. We got the thigh that's nice and flat. Okay, you're gonna come and sit up and do the same thing but switch. Perfect. Keep that knee to your chest as close as possible. Relax. Okay, good. So if we're looking on this side now, lateral still tight, not as bad as the other side. However, if we take a look here, we see now we got even more space from the ground, and the angle, I don't know if you guys can see, the angle here is about 10 to 15 degrees greater than on the other side. So that tells us that the hip flexor on that side is definitely a lot tighter, and the quads are definitely much tighter through here. So now we're gonna go ahead and check out your external rotator flexibility. So you're gonna go ahead and bring your ankle over your knee. That's it with that foot. Perfect. And so we're gonna look at the angle here. So, So if we're taking a look, clearly some tightness there. In an ideal world, her tibia would be parallel with the floor. So we have about a 30 degree angle with the floor right now. And if we go ahead and switch,
Very tender.
keep this foot straight, please. Good. Okay, so if we look at this angle, clearly we have about 10 degrees more, and we have some tenderness. Can you point to me exactly where?
Very uncomfortable.
Okay, right down the inguinal line. Okay, so right now, we're gonna go ahead and test the glute medius. So, what we're gonna have you do here, we have the hips stacked. We're gonna go into abduction and some extension. So it's gonna be a diagonal drive behind you, okay? So you're gonna lift this leg up, and you're gonna push it into me and backwards. Good. Okay, good. We can see the recruitment of the glute med there. 5-on-5 strength. Good. Switch sides. Same thing, hand up. Good. So we have the hips stacked again. I'm gonna lift this leg up. I'm gonna hold it there. And you're gonna resist into me. Go ahead. Okay. A little weaker on that side. A little bit of instability. Do you feel that?
Mm-hmm.
So definitely some weakness there. I would say a 4- on 5. That glute med is not 100% firing right now.
Mm-hmm.
So we're gonna go ahead, lie on your back. Just gonna go through some quick palpation here. So from what the structures we discussed earlier, we can check her ASISs, which are the most prominent bony structures of the pelvis on the anterior pelvis here. So if you can see, we have good movement in the pelvis on both sides. We have even pelvic level right now, and when we go for a little compression on both sides, and when we go side to side, we have equal movement. And we're going to do the same thing now. This is the injured side, so you might feel some point tenderness.
Yeah, that's not comfortable.
Okay, so this area in particular makes a lot of sense, because if we were to zoom in underneath the superficial muscles, this is exactly where that anterior hip is, where a lot of that musculature runs through. Also where the head of the femur goes into the acetabulum. So just in general, when there's a lot of movement going on here, especially if we have that chronic hip strain, hip flexor strain, then we can have a lot of inflammation in this area, and that's from a lot of what we see. All right, Stephanie. So after today's assessment, we've gone through a whole bunch of different tests, from flexibility test to special test to manual muscle test, and what I've concluded is that your left hip flexors, in particular your iliopsoas, is weak, and so based on your history of having chronic issues in that anterior hip area, along with all the exercises that trigger it, and the manual muscle test, we see the weakness in that hip flexion, and especially in that hip flexion past 90 degrees. I think we both saw that, like, you were barely able to hold it there. So I believe that we're dealing with a first degree iliopsoas strain. And because that iliopsoas runs through that anterior thigh, especially right over that area where the head of the femur enters the acetabulo-femoral joint, that can cause a lot of inflammation, which is why when we did the scouring test and I was moving it through that like end range hip flexion, there was definitely some discomfort in that area because we're really like, almost, I wouldn't say grinding, but rolling that musculature over. So if there's inflammation there as well, you said that you felt some swelling and some heat there, so that makes sense. So for now, that's what I believe it is. So we're gonna get you started on a nice rehab program, and we hope to see you soon.
Thank you.
Of course. No problem.